Hi viewers, this is J. Swami, Assistant Professor of Zoology. In this class, we are going to discuss an important endocrine gland, that is pancreas. Pancreas is a compound gland. It works as both exocrine and endocrine gland, so that it is also known as the mixed gland. That is, inside the pancreas, some portion that deals with the exocrine functions by secreting appropriate enzymes for the digestion of different food material. In the same gland, there is an endocrine portion that secretes different kinds of hormones to regulate different metabolical activities. Here, if you see the section of the pancreas, here there are certain cells which are called as the acinar cells. The glandular epithelium of pancreatic acini, otherwise acinar cells, they act as exocrine part of the pancreas. Exocrine part of the pancreas and produces pancreatic juice that contains digestive enzymes like trypsinogen, chymotrypsinogen, etc. Thereby, it acts like a exocrine part. Whereas, if you observe here, the cluster of cells which are present inside the pancreas, they form islets of Langerhans. Islets of Langerhans. These islets of Langerhans, they deal with the endocrine portion. They act like the endocrine portion and produces different kinds of hormones. That is, within the same gland, there is a exocrine part and there is a endocrine part. This exocrine part consists of acinar cells and they produce enzymes, whereas the endocrine part, that is in the form of islets of Langerhans, and they produce hormones. So it is a compound gland, otherwise the mixed gland. So we are not dealing about the exocrine portion, only we deal with the endocrine portion. Let us see the structure and composition of the islets of Langerhans. Here, if you take into consideration a single section, these all are the pancreatic acinar cells. So they deal with the exocrine. Leave about it. In the middle of the section, we have different kinds of cells. Different kinds of cells, namely alpha cells, beta cells, and delta cells, and the F cells. Delta cells and the F cells. There are 4 kinds of cells are present within the islets of Langerhans, namely alpha cells, beta cells, delta cells, and the F cells. These 4 kinds of cells secrete 4 different kinds of hormones. 4 different kinds of hormones. If you observe the contribution of each and every cell, if you see the alpha cells of about 15 to 20%, they contribute 15 to 20% of the cells within the islets of Langerhans, and beta cells you see 65 to 80%, and if you see the delta cells, they are of about 3 to 10%, and whereas F cells, they are of about 3 to 5%. So alpha cells 15 to 20% are there, beta cells 65 to 80, delta cells 3 to 10%, and the F cells they are of about 3 to 5% they contribute to the islets of Langerhans. If you observe furthermore, here the alpha cells, they secrete glucagon. Alpha cells they secrete glucagon. What is the function of the glucagon is it raises the blood glucose level by increasing the glucogenolysis. It increases the blood glucose level by enhancing, otherwise increasing the glucogenolysis. What is the glucogenolysis? Lysis of glycogen. Lysis of glycogen. Breakdown of glycogen, and thereby there is a rise up, that is glycogen get converted into glucose. So as and when there is a free glucose in the blood, there is a increase in the blood glucose level. This glycogenolysis occurs in the liver cells in general. Alpha cells they produce glucagon hormone. This glucagon hormone raises the blood glucose level. So whenever it raises the blood glucose level, it is known as the hyperglycemic hormone. Hyperglycemic hormone. Basically, the glucagon's target organ is liver. Liver is the target organ of the glucagon hormone. So, glucagon hormone secreted by the alpha cells of the Langerhans of islets of pancreas. The target organ of the glucagon hormone is the liver. Glucagon is produced, when actually it will be produced is in response to fall in the blood glucose level. Whenever there is a drastic lower down of the blood glucose level in the blood, and thereby if it is less than 90 mg for 100 ml of blood, if it is below than that, if it is below 90 mg per 100 ml of blood, then automatically the glucagon is produced from the alpha cells. Then as and when it produced, it causes increase in the blood glucose level. How it will increase? By the glycogenolysis. That simulates the breakdown of glycogen into glucose. Otherwise, it may promote the conversion of the amino acids and fatty acids into glucose. That is called as gluconeogenesis. So here there are two processes in the enhancement of the glucose levels in the blood by the glucagon hormone. One is the glycogenolysis, breakdown of glycogen into glucose. Second one is the gluconeogenesis, formation of the glucose from the non-carbohydrate material like amino acids and the fatty acids. So these two phenomena they contribute to the rise of the glucose in the blood. This is the function of the glucagon hormone, which is secreted by alpha cells. Coming to the second one, the beta cells they mainly produce the insulin. The main function of the insulin is that lower down the blood glucose levels by increasing the glucose uptake by cells and by the synthesis of glycogen from glucose. So here there are two things. One is the uptake of glucose by the cells. So whenever the blood contains more and more amount of glucose, it will be uptaken by the cells to reduce the blood glucose level, first thing. And the second thing is conversion of glucose into glycogen, glucogenesis. So these two things are under the control of beta cells indirectly upon the insulin. Insulin is a protein hormone and it decreases the blood glucose level, so that it is known as the hypoglycemic hormone. Hypoglycemic hormone. Whereas glucagon is a hyperglycemic. So here insulin is the hypoglycemic hormone. It decreases the blood glucose level, so that it is known as hypoglycemic hormone. Blood glucose levels play a major role in the regulation of insulin secretion. Whenever there is elevated levels of blood glucose, that stimulates the beta cells to produce the insulin. And low levels of blood glucose that inhibit the secretion of the insulin. So insulin that decreases blood glucose level, one is by the incorporation of glucose receptors. Otherwise glucose transporters, we can say. Glucose transporters, they are the carrier proteins. Incorporation of glucose transporters into the cell membrane and thereby facilitating the uptake of the glucose by the cells, especially the target organs are the liver and the skeletal muscles. That is, they provide glucose transporters to uptake the glucose by the liver and as well as the skeletal muscles of the body. In these cells, glucose is converted into glycogen and stored temporarily. And the second method is accelerating the conversion of the glucose to glycogen and some of the times fatty acids. So glucogenesis takes place, conversion of glucose into glycogen. These are the two things, that is uptake of the glucose by the cells and enhances the rate of conversion of glucose to glycogen. So these are the two functions. So later on we will discuss the deficiency of the insulin. And coming to the third one, D cells, otherwise delta cells, they produce somatostatin hormone. This is a inhibiting hormone in general that acts as antagonistic to the growth hormone and the insulin as well as glucagon. It is a inhibiting hormone. It shows antagonistic effect, that is opposite effect to. Antagonistic means opposite. Agonistic means that supports. Antagonistic effect to growth hormone, insulin and the glucagon. So there is a somatostatin produced from the delta cells of the pancreatic islets. And coming to the fourth one, F cells. F cells, they produce pancreatic polypeptide hormone that inhibits the gallbladder contraction. Inhibits the contraction of gallbladder. These are the four kinds of cells which are present in the pancreatic islets of the Langerhans and their products in the form of hormones. Alpha cells, they secrete glucagon, they raise up the blood glucose level. Then beta cells, they produce insulin that lower down the blood glucose level. D cells that produce somatostatin, which shows antagonistic effect to the growth hormone, insulin and the glucagon. F cells that produce pancreatic polypeptide, which inhibits the contraction of the gallbladder. So as just now we discussed, glucagon, hyperglycemic hormone, then thereby it acts through glycogenolysis or gluconeogenesis. Insulin, hypoglycemic hormone, then the deficiency of the insulin that causes the diabetes mellitus. So somatostatin, antagonistic to the insulin, glucagon and the growth hormone. Pancreatic polypeptide that inhibits the gallbladder contraction. Then see the deficiency of the insulin. Deficiency of the insulin that causes the diabetes mellitus. Diabetes mellitus. Here, the diabetes mellitus, it shows different kinds of symptoms. As and when there is a deficiency of the insulin that results in the diabetes mellitus, the symptoms of this disease are high blood glucose levels, that is hyperglycemia. High blood glucose levels, that is known as the hyperglycemia, and frequent urination, that is polyuria. Some of the times you may also see the blurry vision, tingling of limbs, feeling thirsty, excessive thirst, that is known as a polydyspia, and feeling hungry due to the loss of glucose through urine. So here the main symptoms are hyperglycemia, that is more blood glucose levels in the blood, and the glucosuria, excretion of glucose in urine, and polydyspia, excessive thirst, and polyuria, increase in the frequency of urination. These all are the basic symptoms of the diabetes mellitus. As glucose levels in the cells decrease due to the uptake, fats and proteins are broken down for energy supply. The oxidation of fats generates ketone bodies, which lead to the ketoacidosis. The oxidation of fats generates ketone bodies, which leads to ketoacidosis and fall in the blood pH. It is often fatal. It leads to the death. If glucose level in the blood continuously rises, the patient may fall into coma and finally he or she may die if the symptoms are not at all treated well. So it is somewhat fatal in some people. And you can also see here at a glance, you drink enough water but still feel thirsty. You are peeing more than usual. Your eyesight is blurry. You feel starved even though you just ate. You are getting more infections like UTI, urinary tract infections. You are losing weight without even trying. You are exhausted no matter how much you sleep or how much you take rest. So these are some of the symptoms of the diabetes mellitus. Here there are two kinds of diabetes mellitus based upon the utilization or non-utilization of the insulin. Diabetes is nothing but the urine. The meaning of the diabetes is the urine. Mellitus is nothing but the sweet. Here, diabetes get classified into two types: type 1 diabetes and the type 2 diabetes. So, of all the patients who are suffering from diabetes, the type 1 contributes 10% of people and type 2 contributes 90% of the people. Let us see about the diabetes type 1. It is known as insulin dependent diabetes mellitus. Insulin dependent diabetes mellitus it is caused by the total deficiency of insulin due to destruction of beta cells of the islets of Langerhans of the pancreas. The destruction may be done by drugs, viruses, or by the autoimmunity. Most frequently it occurs in children, so that it is also known as the juvenile onset of diabetes. Juvenile onset of diabetes. This insulin dependent diabetes mellitus accounts for 10% of the known diabetics. It is treated by injecting the insulin. If you provide enough amount of insulin, it may be cured. Then coming to the type 2 diabetes. Type 2 diabetes. Here it is also known as the non-insulin dependent diabetes mellitus. Non-insulin dependent diabetes mellitus. It is not at all dependent. So injection of the insulin may not cure the disease, because here it is abundant amount of insulin is there, but the host cells, the cells of the individual, the target cells of the individual, they may not respond to the insulin. That is the problem in the insulin non-insulin dependent diabetes mellitus, NIDDM. It is caused due to the decrease in the number of insulin receptors in the plasma membrane of the target cells, such as hepatocytes, adipocytes, and the muscle cells. So hepatocytes, adipocytes, and the muscle cells, they are the target organs of the insulin, the insulin receptors. So whenever the hormone is released from the beta cells, that has to interact with the certain target cell receptor. These receptors are not at all in a position to bind with the insulin. That is the problem here. The insulin receptors are integral membrane proteins coded by a particular gene. So due to the proteinaceous nature, they are produced by the gene. Whenever there is a mutation in this gene which produces the receptors, protein receptors, cell membrane receptors of the insulin, so there is a defect in the insulin receptors, thereby that may not bind to the insulin. As a result, glucose is not taken up by target cells and glucose levels rise in blood, which is eliminated in urine. So that indicates that the non-insulin dependent diabetes mellitus is not at all caused by the deficiency of the insulin. But in fact, the patients may have higher levels of insulin, but it cannot bind to cell surface receptors of the target cells. Hence, insulin treatment does not solve this problem. This is the most common form of the diabetes, accounting for 80 to 90% of the diabetic cases. It usually occurs in adults after the age of 35 years, and hence it is called as the adult onset diabetes. The type 1 is juvenile onset of diabetes, but here the type 2 adult onset diabetes. This non-insulin dependent diabetes mellitus commonly occurs in obese persons and who eat more carbohydrates. Increased glucose levels cause increased insulin production but decreased synthesis of the insulin receptors. This type of diabetes can be kept under control by weight reduction, diet control, and physical exercise. In some of the cases, we may also observe another type of diabetes called as gestational diabetes occurs in the pregnant women because of the hormonal imbalance due to feeding for two, that is mother and the fetus. Symptoms become normal after the childbirth. So after that, the female, that is carrying women, that become normal. Here, more than 1 in every 10 adults has the diabetes. 90 to 95% of people with diabetes have type 2. Exercise and weight loss reduce the risk of pre-diabetes, becoming type 2 diabetes by 58%. Over 25% of adults over the age of 65 have diabetes. These are the certain calculations in regard with the diabetes type 2. Here you can see a illustration, type 1 diabetes and type 2 diabetes. Same here, pancreas, there is a decreased insulin in the blood vessels and thereby increased glucose due to low insulin, and here muscle unable to use glucose due to low insulin. Here you can see the glycogen and protein breakdown causing ketoacidosis. Then come to the type 2 pancreas, sufficient insulin secreted in the bloodstream, increased glucose in the bloodstream because muscle unable to use glucose due to insulin resistance. What are the causes? Obesity, inheritance, and other factors leading to insulin resistance that causes the type 2 diabetes. So here it is type 1 and it is type 2 diabetes mellitus. And here we should discriminate the diabetes mellitus versus diabetes insipidus. Diabetes mellitus is a disorder, hormonal disorder, where there is a deficiency of the insulin, otherwise the non-responding activity of the insulin receptors of the target cells. So whatever it may be, it is related to the insulin. Diabetes mellitus directly, indirectly related to the insulin, whereas diabetes insipidus, it is related to the vasopressin hormone, which is secreted by the posterior pituitary gland, posterior lobe of pituitary gland. So due to the deficiency of the vasopressin, so that causes the diabetes insipidus. So that vasopressin is also known as the antidiuretic hormone. It is also known as the antidiuretic hormone. We should not get confused by these two terms. Diabetes mellitus due to the deficiency of the insulin, and diabetes insipidus due to the deficiency of the ADH hormone. So this is all about the pancreas as the endocrine gland. Thank you one and all.